Welcome to Andy's Personal Development, the place for transactional conversations. During these conversations, we'll discover intentionality and clarity, and of course, purpose. Now, here is your host, Andy Anderson Charles. Hi, this is Andy of Andy's Personal Development, and we are currently live on Transactional Conversations. And we have a special guest, Dr. Jeff Gross, is in the house. And before I introduce him, let me just tell you a little bit about the work that he's been doing and his core competencies and his expertise. He graduated from the University of California, Berkeley, with a degree in biochemistry and molecular cell biology. He earned his Doctor of Medicine in 1992 from the George Washington University School of Medicine. He contributed to virology research during his studies. After graduating, he undertook a residency in neurological surgery at the University of California, Irvine Medical Center until 1997. He then pursued a fellowship in spinal biomechanics at the University of New Mexico until 1999. He's licensed in California and Nevada, and Dr. Gross has spine practices in Orange County and Henderson, Nevada. A trained urological surgeon, he specializes in athletic injuries and spine procedures and offers longevity and biohacking consultation. There is so much more, but our focus is going to be on what he's going to share with us today. So, on transactional conversations, the place for intentionality, clarity, and purpose, let's welcome our guest, Dr. Jeff Gross. Where is he? There you go. So he's going to start his video now.
There we are.
There he is.
Hey, nice to meet you. Thank you for having me on, Andy. Sorry for the video delay there.
Yeah, that's all right. It happens, and we also want to apologize publicly for not being able to show this live. But for those who are going to be seeing this after on the different social media platforms, we welcome you and we thank you for your continued commitment and support as we have Dr. Jeff in the house. And he's going to help us understand the fantastic things that he has been doing with his career and his expertise. So, let me begin by asking, how did your journey in medicine lead you to the longevity benefits of stem cells? Let's just get right to it.
Well, my patients are the ones to be thanked for that sort of transition. As you mentioned earlier, I was practicing as a spinal medicine and spinal surgical expert. I took on complex cases of neck and back problems, injuries, disc issues, nerve issues. I took on botch cases and second opinions, all kinds of things. And many of my patients, would be treated with conservative methods, with therapies, with injections, what have you. But sometimes those things weren't enough, or they didn't last long enough. And they would come back and I'd say, well, maybe we should talk about surgical options because that's the only thing I have left for you.
Yeah.
And they would say, well, I have these problems. I'm here for help. But wait, I'm not ready for surgery. And I'd say, great, because it's the very last thing I want to offer you. And we noticed there's this wide gap in between sort of the non-surgical treatments and the surgical treatments for neck and back problems. So my patients will say, well, what else can we try? How about lasers? How about this? How about stem cells? How about stem? You hear that enough. And because of my background in my undergraduate years, as you mentioned, in molecular cell biology, biochemistry, in my days in Berkeley, I said, a few decades have passed since I looked at that material. Let me go back instead of going to the annual, spine surgery meetings when the same doctors are patting themselves on the back for doing the same things for decades. Let me
Yeah.
do something else. Let me
All right.
disrupt that. And I started going to stem cell conferences and educational venues and retraining so I could add stem cells to my practice for spine patients. But once you get back into that and you see what's happened and what we can do and what the possibilities are, it's opened up a huge umbrella of treatments for not just spine problems, but joints and organ problems and inflammatory issues and aging itself. And that's how it happened, Andy.
Yeah, thank you so very much, Dr. Jeff, for sharing. We appreciate the explanation and we appreciate the passion that you displayed as well. So, how does regenerative treatment contrast with conventional medical approaches? What's the difference?
Well, broadly, the traditional medical treatments involve pharmaceuticals, surgeries, things on the menu that have been on the menu for a long time.
Yeah.
And sometimes those just treat the symptom or
All
the,
right.
the ailment, whereas the regenerative treatments really go to the root cause of what's happening at the cellular level, and they tap into the very biology that created us as humans when we were a fetus, and then helped us to grow and develop as a young person, and then help maintain us during our adulthood until our maintenance and repair mechanisms were just not enough. And that's where regenerative medicine comes in. It's a strategy to sort of tap back into that very biology.
Yeah, very interesting indeed. So, what challenges would have arisen from shifting from surgical methods to regenerative medicine, not only for you, but for the patients as well?
Well, the first challenge, at least in the U.S., is who's going to pay for it. So,
Ah,
health insurance is a misnomer because it insures very little of your health.
mm,
It insures some treatment for your sickness.
yeah,
So we've worked very hard to get the cost down so that it's not a barrier for an average individual to be able to achieve this kind of option to help avoid a surgery or help avoid pharmaceuticals or something like that. So that's the first thing. The second thing is, we have to do this within a very safe and ethical confine. And then, so we are very specific about where we get the materials we use, who donates them, whether or not the donors have had the COVID vaccine, for example. Right now, we avoid that because we don't have enough long-term understanding of
hmm,
the potential downside there.
yeah, yeah,
So we're super cautious and ethical about where these materials come from. And just so your audience understands, these come from mothers who are having a planned C-section birth, and after they're congratulated for here's your baby, congratulations. They donate the amniotic fluid, the umbilical cord, the placenta. What used to be thrown away is now treasure.
yeah. Wow, absolutely amazing. Are there any physical requirements for someone who, let's say, have been plagued by an injury, a sporting injury, for quite some time, and they come to you and said, Doc, I think I want to try your stuff, the thing that you do, that you specialize in, this STEM thing that you're speaking about. Are there any physical requirements that you would have for this individual, or is it just a matter of exploiting as you read a new book based on your technology?
Well, everyone is treated as an individual. We like to target athletes, for example. We like to look at an MRI. We
Yeah,
like to make sure that individual is doing everything he or she can to fight inflammation, which is, at the cellular level, the real devil.
yeah,
So, that could be through diet, through exercise, through sleep, through supplements, through all kinds of things, even mindfulness and positive thoughts. And and then we would look at the specific areas of where the inflammatory degeneration is from an injury. And then sometimes it's not an injury, it's just wear and tear, what we call osteoarthritis.
Yeah.
And still, we want to target those areas because if we're going to deliver these regenerative biologics based on stem cells, we want to put them right where they're needed to concentrate the effect, hopefully helping that person with only one application.
Yeah. Okay. Wow. So I know that there are skeptics all over the planet. There are skeptics about AI, its technology, its advancement, its ability to enhance our ability in our specific field or area of expertise. Are there any skeptics with regards to the work that you're currently doing? And if so, what can you do to dispel the misunderstandings that they may have about the success of what you are doing?
Yeah, well, one of the problems in medical training is, you're trained by elder professors usually who are trained by elder professors, and there's a very slow propagation of new ideas.
Okay.
Those who are entrenched in their training and maybe that was me until I opened my eyes and had the open-mindedness to look forward and disrupt what I've been trained and try new things. Um, those people are stuck in their ways and they'll say, oh, well, stem cell medicine is not yet proven. And they couldn't be further from the fact because across the globe, there is a wonderful evidence-based scientific publications on the applications for different purposes and different biologics for different things. So it's not experimentation, although we do try new things all the time, and
Yeah.
every individual of sorts is an experiment. Every patient is a trial of one.
Wow.
We certainly have an amazing set of scientific fundamentals and foundation to rely on.
Okay, sounds good. So then you would have to always make sure that your diagnosis is pretty accurate so that you can achieve the lasting success or the results that the individual require. Yeah?
Yeah, yes, true for all aspects of medicine. You have to have the right diagnosis. Otherwise, if you start treating that diagnosis and the diagnosis is actually something else, then the treatment may fail or even be problematic.
Wow, amazing. Are you doing currently any type of publication with regards to the work you're doing?
Yes, so I have been very active academically. I've published chapters on stem cell medicine for the spine in
Hmm.
textbooks. I have written on cartilage regeneration in joints and spine. I give lectures on that and other aspects of what we call nanomedicine or biotechnological medicine. My current project is I'm working with a subset of regenerative biologics derived from certain elements of the immune cells um, called natural killer cells to help address people that have cancer. So these
Okay.
natural killer cells are amazing. They're a very small percentage of our white blood cells, the immune system, and their job is to identify and selectively remove by cell death cancer cells that we form accidentally during our life, uh, senescent cells, which are also called zombie cells, which are cells that are sort of done functioning. They're
Hmm.
sort of old and bloated, but they
Okay.
still live and leak these toxic proteins into our body, and they take up resources, and those need to be eliminated. So the fewer zombie cells you have, the more healthy your cell population, and effectively, the younger your biological age. So these natural killer cell signaling factors we see as being, they've been shown in the lab and in animals to be effective in helping to address cancer. We're looking to apply that clinically.
Yeah, interesting. Thank you for sharing, Dr. Jeff. With regards to the rate of success, particularly concerning sensitive areas of the physical anatomy, meaning the spine, maybe joints or hip, what would you say have been, in your experience, the rate of success with regards to stem cell treatment?
Well, starting with joints and spine, as you asked, I've noticed the following, which comes from my biomechanical training. Certain joints do better quicker than others. The the flat joints do much better, like the knee.
Okay.
The knee is weight bearing, and it's a couple flat surfaces, whereas the hip and the shoulder are ball and socket joints. And the mechanics of a ball and socket joint is very different and takes um, a bit longer to get the good result than a flat weight bearing surface. So knees are sort of the low hanging fruit. Most of the patients we do knee treatments have early benefits and lasting benefits. And this parallels a lot of the literature from Europe on this topic. That doesn't mean we can't help people with the other joints. It just takes longer, and you have to be patient because remember, your body took, years to degenerate. So we
Yeah.
can't have your body start to repair that and fix it all overnight. Now, having said that, the regenerative biologics like stem cells and their messaging signals are highly anti-inflammatory. So some people feel better right away, just like you might if you got a steroid shot
Yeah.
because of the anti-inflammatory nature. So we have people feel better, but that doesn't mean the repair has been done
Uh,
yet.
yeah. Yeah. Intriguing. Excellent stuff. Thank you for sharing.
Of course.
So, yeah, with regards to stories, do you have any stories that stand out in your mind with regards to your personal experience where people would have received tremendous success and they want to tell somebody, they want to say something about it, or they came back to you and said, Doc, thank you so much, this was the best thing that I had done with regards to my body. And can you share any of those stories that you have had
Sure.
experienced in the past?
Sure. I mean, I have numerous stories of people
I would
that were
imagine so. Yeah.
facing a knee replacement surgery, and they come to me just trying to avoid that. And we've been able to, in one treatment, sometimes just give them their activity, their life back, and keep them off the operating table. But one I'd like to share is I have this sweet woman. She first came to me. She was about 78, and she liked to do these crafts. She would take the rocks, big rocks, and paint them artistically and share them as gifts, and to the postman, to me, to other people, and that was her passion. And she began to have aches and pains throughout her joints and her body, sort of a diffuse arthritis. And we looked at her closely, and she didn't tolerate all the medicines her doctors were giving her, caused all kinds of stomach issues. And she just wanted to paint her rocks again. She couldn't do it.
Mm.
And she could barely cook in the kitchen.
Yeah.
So we tried one IV treatment, and within a few days, she was able to return to activity, household functions, rock painting, and she called me the next week and said, I'm so happy. This is amazing. When do I do it again? And I said, well, you let me know. Let's see how long it lasts.
Okay.
And we talked a month later. She said, yeah, I'm still doing great. I have very little pain. I can move around. And interesting thing, I've had partial blindness in one eye, and it's starting to come back. My light, for decades. So we didn't expect that, but must have had some inflammatory component. And then the anti-inflammatory effects of the regenerative stem cell based biologics helped her. So it was 2 years later that she called me. She said, I'm starting to feel aches and pains again. Can I come in and do it again? And we did it again. And she had a similar result. That was about a year ago. So now she's out there painting rocks and being happy and enjoying her family.
And I guess that's one of the main things that really makes you feel satisfied that you are just using your super gift to bring joy and some form of longevity to people's lives, relief in a way in which they probably thought was not possible. Thank you for sharing.
Yeah.
I have listened to some stories about people like Lionel Richie and Tiger Woods who have had to do regenerative surgeries because of their lifestyle and the amount of time they would have spent on their feet, either performing or playing golf.
Hmm.
Is there a difference between that kind of lifestyle and somebody who is just gone through a period of maybe just exercise, normal exercise, routine exercise, maybe not the gym but the road, in terms of the amount of pressure that it would have put on their limbs and their joints. Is there a marked difference? Does lifestyle really impact upon the challenge that it brings to you with regards to the work that you can help them to overcome through your regenerative stem cell approach?
It sure could. And that's why we like to optimize all aspects of someone's lifestyle, or what we call epigenetics, which is separate from genetics. Genetics
Yes.
is
Yeah.
how you're made up. Epigenetics is how you behave, your
Yeah.
lifestyle. So
Yeah.
we like to optimize epigenetics before we do a regenerative treatment so that people can get the most out of it. But high performers, like the ones you mentioned, really take a toll in a certain area of their body, perhaps. But sometimes, even non-famous people do that. Laborers, household, people that have household chores that take care of a lot of people. I mean, they also take take a toll on certain areas of their bodies, and so although there are those similarities, um, we only hear the stories often of the famous people who have gotten stem cell treatments,
Yes.
like the athletes and
Yes.
performers, like you noted. They also are looking for something that has less downtime than a
Yeah.
surgery, perhaps.
Yeah.
So they have helped us, look for better options than surgical. Not that surgery doesn't have a role and will always be needed to some degree. I think it's a blessing to reduce the number of surgeries and make it, a less of a necessity overall.
Yeah. Wonderful. 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 Now, as technology advances and progresses, and we've seen it in so many different areas, what does the future trajectory of longevity and regenerative medicine hold? Can you visualize it? Can you tell us what the
Yeah.
future? Yeah. Mm-hmm.
Yeah, sure. I mean, we're looking to, slow cellular damage, the pace of cellular damage, which is slowing the aging process. So we're looking at, significant longevity benefits. The earlier you start and the more often you approach these things. We're looking at, there's something called induced pluripotent stem cells, which is taking stem cells backwards into a more powerful state, almost into an embryonic state. And
Yeah.
that's where we're going to be able to learn how to regrow a finger, or regrow a limb. The species that can regrow a limb or a tail, like certain lizards and iguanas and things like that, they are able to induce their stem cells into a more powerful state. So if we learn how to harness that, then you
Mm-hmm.
can imagine the health benefits for people that have had to lose a body part. That or
Yeah.
we need to regrow an organ completely. I mean, imagine, instead of a transplant, you just get some of these specific stem cells. So we need to harness them and control them so they don't go crazy. But that's coming.
Yeah. Wonderful. It sounds like something to look forward to in the future.
Exactly.
Yeah. So, in terms of the work that you do with regards to persons who have lived challenging lifestyles, and I'm speaking about someone who has been abusing their bodies with, I don't want to say illegal substances, but let's say they were under the influence of drugs, alcohol, and they have now stepped away or moved away from that and is looking for a healthier, more sustainable lifestyle. Is there a challenge with regards to how that treatment would then respond to them or they respond to the treatment?
No, I think those types, of people, whether it's self-inflicted toxic exposures, or even, other toxic exposures, maybe something in the air or in the water that was unfortunate, that they didn't even know they were exposed to. These people have inflammatory cellular damage, and the regenerative biologics help to reverse that. So
Okay.
those challenges are specific to toxic exposure, but they don't. They're certainly a candidate to see if we can help them and their cells behave in a more healthy state.
Okay, great. Wonderful. What is the most effective way for people to make contact with you, to reach out to you for your services and your core competencies?
Well, thank you for that, Andy. The best way
Welcome.
is to check our website. It's called ReCellebrate, ReCellebrate.com. That's ReCellebrate, because we are celebrating the renewal of your cells. And the we also have a LinkedIn and Instagram and all the social media at the same name. And I think we're the only group using that particular spelling of that name. So you shouldn't be mixed up with anyone else. It should be straightforward. So look for us at ReCellebrate.com. We have YouTube videos. We have other podcasts and all kinds of things that you can look at.
Yeah, great. And I'm going to be able to also include that in the show notes as well.
Thank you.
So thank you for sharing, Doctor. Uh, to the skeptics, those who are really, really deeply skeptical about the ReCelebrate work and the progress that you have made and the help that you've given to people with regards to longevity and the healing benefits of stem cells approach, what's your final message to them?
Open your mind, take a second look at the research. Let's have a conversation. Let's talk about it. If you're closed off and you're a skeptic because you're closed off, then you'll always be a skeptic to this and other things. And I'm sad.
Wow. So when you look back, and this is my final question before we close off, when you look back and you realize how far you have come, the breakthroughs that have been made, is there some sort of mentorship program that you would like to put in place so that you'd have others being interested in this kind of technology, maybe young and upcoming surgeons who are looking to understand many different ways in which they can be progressive with regards to stem cell approach and help people? And is there that kind of program that you're looking at from a ReCelebrate perspective?
I don't have a particular program, but I love to meet people who are interested in this field and talk to them and offer my time for a
Yeah.
conversation and guidance, whether it's a student who's coming up and looking to add things, whether it's an old doctor like me who wants to try new things, or patients or potential patients, or if you have a loved one who might benefit from something that we can talk about. We love to meet new people and have that conversation. So although I don't have a mentorship program, I think I do mentor people sort of one at a time on that basis.
Yeah, wonderful. Did anyone mentor you, as a matter of fact?
Yes, so many, and I'm grateful for the professors that taught me different things along the way, and the patients that didn't know they were teaching me along the way, and my colleagues, those collegial people who have shown me different things, and I've pulled together all the best elements to offer what I do for people now, and I'm grateful for that.
Wonderful. So there you have it, folks. Dr. Jeff Gross, the pioneer behind ReCelebrate, a fantastic organization. Please, you can reach out to him at their website, Instagram, TikTok, YouTube, LinkedIn. We have all that information we're going to put in the show notes so that you can make contact with them with regards to their advanced levels of technology with stem cells. So, until next time, this is Andy of Andy's Personal Development on Transactional Conversations, the place to discover intentionality, clarity, and purpose. And we had a full dose of all three with our guest, Dr. Jeff Gross. We say so long, stay safe, stay healthy, be strong. Until next time, bye for now.
Bye bye.